Good morning you guys, it's Karen and I'm finally here to do this video for you on how to avoid your brows drooping if you have Botox. You may know or you may not know, but I'll link the videos. I have done a video on my Botox Gone Wrong. The first time it went horribly wrong. And then more recently I had the brow droop problem, though nowhere near as pronounced as the first time. So I've been through this twice, and interestingly I've been having Botox for something like 8 to 10 years, probably more like 8 actually. I can never remember the first time I went, but it's many years. And I have gone through many different practitioners because I'd find the perfect one and they would quit and go back to nursing in the medical industry, or they would leave and move city, or something would happen, and then I was searching for somebody. I could never find people to do what I wanted, which was a brow lift. So I'm going to talk today about, I'm going to talk you through the muscles of your forehead and your eye area, what your expectations should be when you go to have Botox, things to avoid if you don't want to have the brow droop. And I'm also going to give you some examples from websites online showing you the different areas that they recommend to have a brow lift done. So this is kind of focused on a brow lift, and it's not to say that you can only get brow droop if you are going in for a brow lift. If you're going in for horizontal lines, it's a risk as well, and I'm going to talk about that later. I'll give you a quick overview of muscles because I think that will help when talking later about what to avoid and where the injection should go, that kind of thing. The main forehead area has got two muscles here, which are the frontalis muscles. So basically your forehead is the frontalis, and that is what holds your eyebrows up, what helps you raise your eyebrows. So when you do this, I can't raise my eyebrows that much because there is some Botox still left in, but if I raise my eyebrows, that's me using my frontalis muscles here, two big muscles like this. So raise my eyebrows, I'm using my frontalis muscles. Then there is around the eye, surrounding the eye, there is an outer and inner part to this. There is the orbicularis oculi, and so like I said, that goes right the way around the eyes. There's the outer and inner part, so it goes right the way around there. That is responsible for pulling the brows down. It's responsible for down movements basically. It closes your eyelids, for example, and so the orbicularis oculi is here and is responsible for, if you frown, your eyebrows come down. So you can see this is me raising them using my frontalis, this is me pulling them down using my orbicularis oculi. The other muscles I want to just briefly mention is you've got your corrugator muscles that are kind of here. There's another one, a depressor as well, but the corrugator muscle is what also helps you frown, but you know how I said if your eyebrows are being pulled down, then it's pulling this bit down, but if you frown and it pulls inwards, that's your corrugators working. So where you get your 11s lines, as they're called, is where you are pulling your eyebrows in. Again, I can't do it too much. I used to have very big 11s, and that is caused by these corrugator muscles. The final one I'll mention briefly is the ptosis, which is here. And the ptosis is really more to do with your nose wrinkles. If you smell something you don't like and you wrinkle your nose, it's responsible for these wrinkles, but it also does form some horizontal lines. So if you get a line just here, a horizontal line from frowning, from that sort of frown expression, then that's caused by the ptosis. So just a quick overview of muscles there. Like I said, there are other ones, other smaller ones, but this isn't a science lesson. This is just to give you some information that I hope will help people avoid what I've been through. You've seen the pictures in my other videos, but I'll quickly insert some pictures so you can see exactly what happened to me. What I wanted was a brow lift about here. I wanted this lifted and this knocked out in the middle so that my hooded eyes were more wide and less crepey, basically. What happened was it pushed my eyebrows down, and there were several reasons for that, which I will talk about. Okay, the next thing you can do to avoid the drooping eyebrow and get the results you want are to manage your own expectations. When I went to the guy at the beauty show, which I'll talk about later, and it went horribly wrong. He later admitted that because it was at a beauty show, he wasn't able to manage my expectations well because he didn't have time. It's very factory, quick. There's not a huge amount of time for a consultation and for him to really understand what I want. So I think before you go in, make sure that you understand exactly what you want and what's possible and what's not possible. So for example, if you are going in because you have horizontal lines on your head, so remember I said the frontalis is responsible for if you raise your eyebrows, and it will also cause your horizontal lines. If you are going in for horizontal lines and a brow lift, you need to be extra careful, because a brow lift is pushing up like that. You know, you are lifting your brows, you're going to push more horizontal lines. To then smooth out the horizontal lines, you really need to sort of push up there and down there so that you smooth out the forehead. Not many people realise that to get the both is near impossible. It's not impossible, it's near impossible. When I say that, because you can have, sorry, I've got hair in my face. You can have it done, but you can either have a mild effect on your horizontal lines and a more pronounced brow lift, or you can have more of an effect on your horizontal lines and a mild brow lift. You won't get a really good brow lift with a smooth forehead, because it just doesn't make any sense. Because to get rid of your forehead lines, your horizontal lines, you need to smooth the brow out by pushing it up and pushing it down, if that makes sense, and that is going to push your brow down. There are techniques, like I said, that can combine the two, whereby you would push it, if the horizontal lines are in the middle, you'll push it down here and lift it up here, but then it all depends on the shape of your face, etc, etc. It's very complex. So that's one thing. If you're going in expecting those two, perhaps think about which is most important to you, and go for that one treatment and see what you think, and then see if you can add in. So if you want the brow lift, have the brow lift, see what you think, and then try and add in having the horizontal lines taken away, or vice versa. So when you're going in for a brow lift, the person looking at your face will judge how much of a brow lift you need, and whether you need to have a brow lift here, here, here. At what point along your brow do they need to make an arch? And that's where I think that we should be saying, this is where I think it would look best, this is what I want done. Because as we'll talk about in the research section, you've got to research the person you're going to, and again, everybody has different opinions on this and says that the risk of drooping is simply down to the person that injects, and it's not. I've been to dentists, I've been to doctors, I've been to nurses, and I've been to beauty consultants. I've been to the whole array of people, and there are differences. If you go to a dentist, he's not going to know what will suit your face in a cosmetic way. So what you need to think about is, do you want a brow lift like this? Do you want a brow lift like that? Do you want a brow lift like that? Obviously that's very exaggerated, but which part of your brow are you looking to lift? For me, because I want it for hooded eyes, it doesn't really matter in that if I lifted it there, it would definitely help. But the best result for me is if I have it lifted a little bit here, because that's where when I close my eyes, my skin wrinkles from there, from the outside. So if I have a little brow lift here, it means that it smooths out the skin on my eyelids there. But think about, you know, exactly where you want it, how much you want it lifted, etc. Okay, next I'm going to talk about things to avoid if you want the best result from your Botox, and again, to avoid the drooping situation. The number one thing that they should tell you is, do not lie down or bend down for 4 hours afterwards. It's actually more difficult than you'd think. For me, it's lucky that the first person that did it, Leona, said to me, don't go shoe shopping, because you don't even think about it. And whenever I have gone to have my Botox, it's often in a shopping area where I'm going to go shopping afterwards, and if you are trying on shoes, you're bending down. So don't go shoe shopping, don't bend down, don't lie down, don't go to the gym. You just need to sit down, relax, and don't move, basically, because you can move the Botox. If you lie down, the Botox can move. If you bend down, the Botox can move, and it can end up in the wrong place, and that is, like I said, for the first 4 hours. Number two is, don't touch your face. Don't push it around, try and massage it, try and feel. Again, that could move it. I don't know whether you should try and make movements or whether you should not try and make movements, because I've had 50-50 advices on that. I wish I could remember what Leona told me, but I can't. But like I said, sometimes people have told me, okay, don't try and like make expressions and be looking in the mirror constantly and seeing if it's working. Just act as normal. Other people have told me move your eyebrows, that helps, you know, that try to make the expressions, that doing that will help it. In my head, trying to make the expressions will, like if I tried to frown and tried to lift my eyebrows and there was Botox in there, it will also move it about. So to me, I would say don't make any expressions, just try to forget about it, except for not bending over. One final thing I would say to avoid is avoid having it done with somebody that you don't know, that you haven't been to before and that you don't trust, and or before any special events, if you have any special events in the next 6 months. Now, I know for a lot of people you will have events coming up, but if you are getting married, your daughter's getting married, whatever it is, if you've got a graduation or any big event and it would devastate you to have droopy eyebrows, and it's say even 4 months, maybe 3 to 4 months away, you're okay. But any nearer than that, I would say don't bother. Don't have your first Botox treatment then. Try to wait until afterwards. It's a shame because that's the very time that you want to have good Botox. I had it done before my wedding, but I had it done with the nurse that I had seen. I saw her about 4 times before she told me that she was leaving. And I remember it was the last Botox I had with her, and she said, "Oh, you're going to kill me, I'm leaving." And she went back into medical practice. And even then she said to me, you know, "You sure you want this done? Because there's always a risk of drooping." And thankfully for me, it didn't happen, but I would not recommend, now having been through it, I wouldn't recommend having it done for a special occasion. Okay, so research. I was often told in the comments of the videos where I've said about my eyes going wrong that it was all down to me choosing the wrong person, and I don't agree with that. I do think that of course you need to research who you're going to, and that should be your number one concern. Before you do anything else, find out that the person you're going to is qualified and experienced to do Botox. But what does that actually mean? It means that they have some kind of qualification in facial anatomy. So that could be that they are a nurse trained in Botox, or it could be that they are a plastic surgeon that specialises in facial reconstruction. It could be they are a dentist. With beauty therapists, they can administer the Botox, but it has to be prescribed by a medical professional, so a doctor, or I don't know whether a nurse can actually do that. The first lady I saw was an ex-nurse, but she was a beauty therapist, and it was her I learnt that from actually, and I've double checked that the law is still the same in the UK anyway, that you can train, as a beauty therapist, you can train to administer Botox, and you can train to learn about Botox and even be an advanced practitioner, but you cannot do the consultation and you cannot prescribe it. It has to be prescribed. So the way they worked in the clinic I went to is I first saw the doctor, had a consultation with him, and then he was able to do the prescription, and I came back and saw the beautician, who was an ex-nurse actually, and she administered the Botox. That doesn't really make any sense to me, and there's a lot of contention around beauty therapists injecting patients with Botox. I know that there is a lot of people that don't agree with that, so it's up to you whether or not you would want to do that. You know, there in theory there are positives because they know more about the cosmetic aspects of your face. And it's a difficult one for me because let me talk you through who I've been to and what's happened. I have been to, the first lady I went to that I talk about, Leona her name was, and I'll never forget her because that was my first experience of Botox, and I didn't even know there was such a thing as a brow lift. I just wanted some Botox, so I had it done for my glabella and for my crow's feet, and she said, "I'll give you a little bit of a brow lift as well," and she put a little bit in the outer part of my eyebrow. And I loved the results. It completely smoothed out my eyelids and I was just over the moon. Leona was an ex-nurse. She hadn't kept up her nurse qualifications, but we talked about the hospital she worked at, and we both actually had worked for the same cardiologist boss. But she was basically a beautician, but an ex-nurse, and she did the best job. Then when I found out that she'd left, I went back to the same clinic where I had it done, and I had it done by, now, yes, she's a doctor, a lady that is a doctor that does Botox for celebrities. I was a bit dubious because I had been to her for potential teeth whitening treatment at another place, but I never went back to her because it was a horrible experience. It's a whole other story. And so I was a bit dubious, but I went to her. She seemed very lovely. Like I said, she was a doctor, and she She did the Botox and it hurt. She didn't tell me what she was doing through any of the procedure, and the results were zero. They weren't bad results, they were just zero. I could still move my whole forehead. So I went back in, you know, they did a lot of places do, and I believe should do, a 2-week review. And so I went back in and had this free review, and I said, well, I can still move my eyebrows. There's nothing has frozen or relaxed or whatever. And they put some more in, she put some more in, and it still did nothing. So she was a doctor. Then after that, I decided, okay, I'll go to my dentist, because my dental practice did Botox. So I had it done by him. I had exactly the same problem. I had total movement of my face. I went back in to see him and he did it again, and he just could not achieve any frozen, if you like, muscles, any relaxation. Whether or not it's because they were doctors and dentists, they were too cautious, I don't know. So after that, for me, I thought doctors and dentists have not worked for me. I'm going to see a beauty consultant. So I saw a beauty consultant, and she again could do nothing. I don't know whether there was something going on in my body that year, but I was just having Botox and it was doing nothing. It wasn't, I still had full movement. And actually I remember I saw her again in the 2-week review, and she said, you know what, if this amount of Botox doesn't work on you, nothing is ever going to work. And I just was totally confused by that, because I'd had it work before when I had it done with Leona. So after her, I went and had it done by 2 nurses, 2 girls who were, well, one of them was lovely, and they did great prices, but unfortunately their customer service was appalling. I would turn up and they'd forgotten to put my appointment in, so I had to rebook it, and then that happened a few times. They didn't really want to do the 2-week review. They didn't like the frozen look, and so they were very reluctant to do it. Although I did get them to do it. It's a shame, because they could manage to do exactly what I wanted, and it proved to me then, okay, it can be done. I'm just going to the wrong people. The next one that I remember, because I have seen quite a few over the years, I had one lady that actually came to the house, and again, no effect whatsoever. I think that these people are all being very cautious and not putting enough in. I know that I need quite a lot to get the result that I want. The next one after that was at a beauty show, and I would not recommend that. But I went to this lady who was a nurse, another nurse, and I told her of my problems, and I said, look, I don't have high hopes that you can achieve what I want. I normally need a 2-week top up, and obviously I'm not going to be able to have that, because if you go to a beauty show, you're not going to be able to get anything after 2 weeks. You're done. If it's wrong, it's wrong. You can't go back to see them unless they happen to be in your city. But she was from London. But I decided to take the risk, because I was kind of at that point, I couldn't find anybody else in my area. I didn't know who to go to. So she did it at the beauty show, and it was amazing. And I was like, brilliant. It just seems to be nurses that work for me. Then I had it done with her again. I would literally go to the beauty shows that I knew they were going to be at, and they'd tell me, we'd email, and I would go to see her. I went to the Girls' Day Out show, not this year, last year, and with the aim of going to see her and having my Botox done, but she wasn't there, unfortunately. She was supposed to be there, but she wasn't. So I was chatting to another company that was there called Botox, B-E-A-U-T-O-X, I think that's how it is, Botox. And he offered me a massive discount, because while I was standing there, somebody had recognised me and come to say hello. And one of his girls knew of my channel, and so he offered me a big discount, and he specifically did a brow lift. He was specifically advertising a brow lift, so I was like, he must know what he's doing. I knew his name from when I worked in hospitals. He was a plastic surgeon. So I had my Botox done with him. I also had my lips done, and that's the first one that went horribly, horribly wrong. So that was only last year. So like I said, I've been having it done for many years, and it went horribly wrong with him. Then after that, I had Botox done with Dr. Bong, and that was absolutely fine the first time, but it wasn't, he was cautious, and I said to him, I need an awful lot, and he said, I'm going to be cautious the first time because I don't want any droop kind of thing. The second time, it was exactly as I've told you here about your expectations and knowing what you want. I didn't get across properly that I didn't care about horizontal lines. I know that by pushing this up, it might create some lines. I know that I might have some horizontal lines, and I don't care. I don't want them touched. All I wanted knocked out was this bit, and I wanted to hold this in place, and I didn't communicate that well enough, and so he put some in my forehead, and with that I got a brow droop, nothing near as severe as the one from the beauty show. So I can categorically say that for me, nurses are the best, and I will try to have it done by a nurse. I don't know why, because nurses don't have specific knowledge of the face, but I think that maybe the nurses that I've seen are nurses that have gone on to do beauty qualifications and therefore learn about the face, and so they have the combined anatomy knowledge coupled with the cosmetic knowledge, and so for me that has been the best outcome. Okay, so where should you have the injections to avoid getting a brow droop? This is where it gets very, very complicated, because again, I've heard practitioners say as long as you don't go below the brow, as long as you don't go this way, as long as you don't go that way, and nobody seems to be able to agree on one thing. From my experience and my research and knowledge of the anatomy of the face, which is not as a professional, I must add in, is that if you have anything done on your forehead up here, then you're more at risk of a droop. Because remember I said that these are the frontalis muscles, these are responsible for raising your eyebrows. So anything here that is knocked out or too much put in is going to do the opposite, and it's going to push your eyebrows down. So to me, I will now in future just say I do not want anything done in my forehead above about here. So if you want to be 100% sure, I would say don't have anything done above the pen line. But that is not 100%, because there is, like I said, it's not simply that pulls up and then therefore if you inject it that drops down. It's also to do with the strength of the muscles surrounding it and how they work as an opposing, I was going to say team, but there is a way where you can inject in there and then inject down here, and so this pulls up but this goes down, and therefore it creates a certain arch. There is definitely a way of doing it, but I now would find it very hard to trust that somebody could do that without there being a risk of droop. I would also say nothing underneath my brow line here, or maybe just a tiny touch underneath, but the places for me that I will have my injections will be right at the tip of the eyebrow, to get the orbicularis oculi, which pulls that brow down, and then hopefully that will lift that end up a little bit, and then one each side here in the corrugator. So one, I don't know the exact spots here, I'm not going to say that I do, but somewhere around here, which is why I said nothing kind of above that, but here or closer to my eyebrow, one on either end of the eyebrow, inner end of the eyebrow, and then one kind of here, and that is the ptosis and the corrugator where they pull in. I want to knock those muscles out, but not high. I do not want them up here, because that's going to knock out my frontalis. The injection sites might be very different, because the thing with Botox is that it's not just about injecting the right place, although that obviously that's the main thing. The main thing is injecting the right place, but here's the thing, you don't always know the right place, because even I was watching a training session, I've watched as much as I can from the professionals that are teaching Botox, you know, to try and see, well, what are the issues here? And a lot of the issues are that a practitioner, be it a nurse or whoever is doing administering the Botox, doesn't know your facial muscles. They don't know how large the muscles are, or how small, or the exact positioning, because we are all unique, how strong your muscles are, how much you use those muscles, because everybody uses their muscles in their face very differently, depends on your age. There's so many different things about the face. How many fibers you have, how many medial fibers you have will depend on how much you need to be injected, the depth of the injection, the direction of the needle. These are all things that will affect the outcome of the Botox. So for example, if you are injecting here, if you inject a spot there and you point the needle upwards and go very deep, it's a completely different outcome to if you inject there, point the needle downwards and just inject a tiny amount and don't go too deep, you know, or don't put the needle in too deep. It's a completely different outcome. So it's not something that is completely within your control. Unless you're sitting with a mirror while they're injecting and you're going, no, point it downwards, point it left. You're not going to be able to control that, and I don't think that you should for that part, because, you know, we're not qualified. That's why they're doing it and we're not doing it to ourselves, you know. So what I want to show you now is some photos from different sites that show you different ways of doing a brow lift. And it's interesting because they are all different. So I'll talk you through them as they're on the screen. So the first one you're seeing is just a whole load of coloured dots, and I don't know if you'll be able to see the writing across the bottom, but it recommends that the yellow points are for a brow lift, which are right on the very end of the eyebrows. So it's just one little point on the very outer part of the eyebrows. This guide is from a company called the Aesthetic Centre for Plastic Surgery in America. It says see our Houston location, so I'm not sure. Yeah, Houston. So it's in Houston. So that's from plastic surgeons. So they say just one point on the outer edge of the brow for a brow lift. Okay, the next photo is showing you that an eyebrow lift would be above the eyebrow, and that is about, I don't know, what is that, about a centimetre in from the outside edge. So that's yet another place that they are suggesting that you would inject for an eyebrow lift. The photo I'm showing you, I just don't understand how they've made this assessment, and I would not recommend going to the Bloom Med Spa. They're showing you to do it sort of halfway between the top of the eyebrow and the top of the forehead, sort of towards the outer part of the eyebrow. But for myself personally, I don't think that that is the right place to inject for a brow lift. I have never seen any other person apart from this Bloom Spa, I'm going to find out where that is, recommends having it done there. It's not to say that it couldn't work. It would depend on all of the other injection sites and how the muscles were working together, but that's certainly not a common place to inject. The last three pictures I'm going to show you are, I think, the most interesting, and they are from an ebook called Minimally Invasive Procedures for Facial Rejuvenation, and they are edited by two scientists, and they show that there are three different ways of doing a brow lift. And let me show you the first one. The first picture shows that there should be a little spot of Botox put underneath the brow, and I'll read you what it says. It says the first technique is suitable for a mild lateral eyebrow lifting when the opponent elevating lateral fibres of the frontalis muscles are strong enough to produce the lifting effect, with the antagonist blocking. So that sentence should give you an idea of what I said about them being complex. It's a complex combination. So, but this will only give you a mild lift on the outer part of the eyebrow. The next technique is showing a kind of sort of diamond there, isn't it? And I would say I've had this technique done before. I would now choose to have that done without those two top dots, because that's where I feel it has to be right, and it has to be within a millimetre of precision. Otherwise it can go wrong. And it says here the second technique is generally used only when the lateral aspect of the eyebrow needs elevation and there are not many horizontal fibres in the forehead, only in the midline. And that is the case for me. I don't have many horizontal lines actually. And it says it consists of the full blocking of the medial fibres of the depressors and partial blocking of the medial fibres of the frontalis muscle. So see where those 2 points are above the sort of upside down triangle, that's the frontalis. So they are using some injections in the frontalis, which I would be uncomfortable with personally. So 7 injection points are made, treating the corrugator muscles. It gives the dose range and a dose range per point. But you can see that that's a completely different way of doing it to the first way, and this is the same physician that is saying this. The final picture, which is from that book as well, is showing you actually a third and fourth way of doing it. And the injection points showed here are all along the eyebrow. This says this is the most appropriate for medial, intermediate and lateral eyebrow lifting. So basically if you want all along the eyebrow lifted, not just at the end, then it says it consists of the use of 3 to 5 injection points within the hair of the eyebrow. And that the injection should be superficial, not deep, with the needle pointing upwards, located at 0.5 centimetres above the bony orbital rim. It then explains that it can be between 3 and 5 points along the eyebrows, spread out depending on where you want it, whether you want the middle of your eyebrow lifted, the outside or the inner part, or all of it. On to solutions and treatments. Are there any? What can you do? There's two types of ptosis. Ptosis just means drooping. You can either get an eyelid droop, whereby one eyelid would be droopy like that and wouldn't fully open, or you can get brow drooping, which is what I had both times, where your brows are heavy and drooped. For the eyelid drooping, you can use eye drops that are used for glaucoma. I think it's called iopidine or something like that. I'll leave the name for you in the description. I don't think it's something you can buy over the counter. They are used to treat glaucoma. So I think your best bet to get those, if that's what's happened, is from the person that treated you. And I think using those a couple of times a day should help. And eyelid ptosis doesn't last as long as brow ptosis. So if it's your eyelid that's drooped, it won't last as long as if your brows have drooped. If your brows have drooped, there is no reversal of Botox. I'm really, really confused by one video that is on the internet. And it's a lady called Daisy saying that her Botox went completely wrong and she had it dissolved, but there is no such thing as something that can dissolve Botox. That isn't the action of Botox. Is not, there isn't anything to be dissolved because it causes paralysis of the muscles, and so there is no known antidote to Botox. And I thought, I checked Google to see if there was anything more, if there was any more research, anything new out. And I even sent an email to a plastic surgeon that I was actually a patient of his. Then I worked with him. He's now left the NHS as well. Anyway, I asked him, are you aware of any new antidote for Botox? There isn't such a thing. That it isn't possible. Once you are paralysed, you need to just wait for the effects to wear off. It isn't something you can undo. So I'm not sure what happened with that lady, because she said she went in and they put in a dissolving solution. I suspect that they either injected saline, which is basically a placebo effect, that she had a placebo effect. It's a nothingness. And that it would have worn off in that time anyway, because remember I said if you have eyelid drooping, it will wear off in 1 to 2 weeks. And so by that point, she was at, I think, the 2 week mark, or the 1 to 2 week mark. So it would have worn off. And I think that clearly she wanted something done. So maybe they did that, which would be very unethical. Or I wonder if they didn't give her Botox, but she thought it was Botox. I don't know. I just don't understand, because I think she's a very honest girl, so I don't think there's anything in that. I just think somewhere along the line something isn't right in that, because you cannot dissolve Botox as of today. So anyway, you can't do it, but what you can do, there is some hope in that with all of the muscles and how complex they are, you can try and inject in other places to give some lift back, depending on how much Botox was put in. If you have got a brow droop because too much Botox was used and your whole forehead is frozen and you can't move it, then it is unlikely there's anything that they can do. For me, the first time round, I said to him I wanted to go back and have him inject to try and give me a little bit of lift here, because I still had a bit of movement. I could still move the outer part of my brow. So I went back and asked him to try and correct it. He did inject, but it did nothing for me, unfortunately. But there are cases where, like I said, it depends on where you've had the injections, how much of a droop you've got, what else was injected, what other treatments you had. But go back to your practitioner and see if they can have a look, and if there is any opposing muscles that will maybe pull back against the ones that are relaxed and help in that way. But other than that, it is unfortunately a waiting game. How long does it take? It takes, if you've had Botox before, it will probably wear off in the amount of time that you're used to it wearing off. If you've never had Botox, it can wear off within 2 months to 6 months. To some people it even lasts longer. For me, I think it took about a couple of months. So it's not going to wear off in weeks, or it's unlikely to wear off in weeks, but it will soften in weeks. Something to note is, although you won't be back to normal until say 2 months, between 2 and 6 months, but more likely about the 3 month mark, you'll be able to say that's me back to normal. I'm at 2 months now since the mild drooping from my last Botox. And I have some movement, and I'm not completely back to normal. I would wait for another month and then I would say I will be back to normal. But through that whole process, it's not simply like that and you suddenly are okay again. It is a line, we'll say an upward line back to where you want to be, basically. And so it will soften as every day goes on. It's the only kind of positive thing I can say to you. It will improve every single day. As time moves on, it will soften every day and it will get more and more towards being more like yourself. For me, this time wasn't even upsetting because I had already experienced it, and I don't think it's as bad the second time it happens. But the first time I was devastated, and it wasn't because I had hooded eyes, it was because I looked nothing like myself. Well, I suppose it was partly because I had hooded eyes, because that was what I was trying to reverse. I didn't like my loose crepey skin. I wanted to smooth out my eyelids by pulling my eyelid up, and instead it pushed it down like this. And as Daisy said, I put my makeup on and it transferred up onto my eyes, and it was just, that was the really hard part for me. But I learned how to do makeup for my hooded eyes, and I think that's a plus from it. And you know, it's been a good learning experience. So if you have any questions at all on the drooping, the process, etc., leave them in the comments below. If it was something that I've mentioned in videos before, I may redirect you to those videos, because I have done my successful Botox before and after, my brow lift on here already. So that's everything. Thank you very much for watching. Let us know of your experiences. Has this happened to you, and how long did it last? I think that will be really important to people watching, because it varies from person to person. So let us know. Thank you again.